Going to begin with the removal of the makeup. Right, we're going to be doing the skin peel now. So what I'm going to use is a very mild alpha hydroxy peel. It's only a 5% alpha hydroxy. It's very mild, and what it's supposed to do is just help to dissolve the bonds between the dead skin cells so that we can just get off a little bit of the dead keratinized tissue, and then we can get more of the product into your skin during the treatment. I'm going to apply the product to the whole area, starting at the lower portion of the face. Just using the fingertips to get a nice even coating of the alpha hydroxy all the way around the skin. Being careful not to get too much into the crease of the nose because it can get a little bit sensitive. So we just go around the crease of the nose, and also being careful not to get too much actually onto the lip. Now the client will experience a mild tingling sensation while the product is on. It's just a very mild peel for the skin, so it's not going to be excessively tingly, but your client will be aware of the sort of tingling sensation. Just make sure we get nicely around the nose and onto the forehead. Obviously, if your client has any areas of sensitivity, just be a bit more careful not to put too much product on. Are you feeling any tingling?
Yes. Okay.
Now you can leave the product on for up to 10 minutes, but what we advise is we leave it on until the skin starts pinking slightly. We don't want the skin to go too red. You don't need to leave it on for a full 10 minutes, 5 to 10 minutes, as soon as the skin starts getting a little bit flushed. We're now going to remove the peel from the skin, just using cotton wool with some saline or distilled water. We're going to just gently remove the excess product. Paying special attention to get into all the little creases around the nose, edges of the mouth. Making sure you've gotten rid of all the alpha hydroxy. If you don't, it will keep continuing to tingle and peel the skin whilst you're working, so it's best to get the product off properly. Also, any residual excess makeup and skin oils and impurities will come away with the peel. So for our treatment, we're going to be using this particular cartridge for the treatment, and you attach the cartridge to the handpiece in the same way you do with your regular cartridges and click down firmly. And what you'll notice with this cartridge is it has a wider opening at the front, and what you'll see exposed at the front is a plastic needle plate with 18 plastic needles. You'll also note that the needle plate is slightly rounded and also moves slightly from side to side, and this is for on use in the smaller areas of the face, like around the side of the nose, around the contour of the eye, meaning that the needle plate adjusts itself so you can get nicely and firmly into all the contours of the face quite comfortably. The depth of these needles, they are 0.5 millimeters in length. Once applied to the skin though, you will usually only achieve a depth of about 0.2 to 0.3 millimeters with the product. So once you've engaged your cartridge with your handpiece, you seal the handpiece as you would usually do. And select the appropriate product that you're going to be using for your client's skin. So we're going to place some of the product, firstly, into the hole in the cartridge. So that's applied a few drops into the cartridge. Also, what we do is just apply a few drops to the face to make sure the face is moisturized and comfortable, because you don't want to drag a dry needle across the skin. So if you apply a small amount of product to the face before beginning, it's not so uncomfortable for your client, and the needle can glide a little bit more easily across the skin. So you must never apply the product, the needle straight onto dry skin. We're going to leave the machine at a speed of 100, nice and slow, so it's comfortable for the skin. And we're going to start in the center portion of the face on the chin area. Now you need to angle the cartridge so that it looks like it's flat to the skin, and we're going to be using a series of circular motions working our way upward, up the face. So we're going to start in the center portion. Now your client will feel this being a little bit prickly. There we go. You should see the product coming out of the capsule nicely onto the skin. You need to support the skin as well, so that you're not pulling too tightly. This area until we see that little bit of pinkness and the product has been absorbed nicely. Alright, so I'm going to move on to the sides of the face, still working upwards, and you can see I'm going a little bit faster now because the cheek area on the lower portion near the jaw is not as sensitive. I'll probably slow down here a little bit, but you can go quite quickly on the outer areas of the skin where it's not so sensitive. You can then also work your way up the side of the nose. The nose again, be careful of the crease of the nose because that can be quite sensitive and be prone to quite a bit of capillary damage. So just be a little bit gentle coming up the nose. We're going to do the filling. Quite a bony area on the forehead, so I'm just going to be a little bit more gentle. You can see it goes red a lot quicker because the skin's a lot thinner. Then when you're finished, you have a little bit of excess product on the skin, which you can gently rub into the skin, making sure it's nice and evenly distributed. Make sure it's all absorbed. You can then put on the prescribed aftercare cream. So we've got individual use aftercare creams that are very soothing and protecting for the skin. So you just need a little bit of that aftercare cream. Dot that around the face and gently rub into the skin. Spread it around and then pat nicely into the skin. This is just going to form a bit of a protective barrier to protect the skin, help keep the moisture in the skin, and also help to soothe the skin a little bit. You can give your client the rest of the aftercare tube to use at home, so they can finish off using that product at home as an aftercare. Also, whatever is left of your ampule that you apply to the skin, that can also be given to the client for home usage. So they could apply the rest of the ampule probably tomorrow morning, or if the treatment was done earlier in the day, you could apply it in the evening. What you would advise your client to do, if they had any makeup on, such as a little bit of mascara or something, it needs to be removed with warm water. No cleansers or products need to be applied to the face in the evening, only the aftercare cream. Alright, so I'm going to be using the Cool Spot again, which mostly we've been using to cool down the lips and on the face before the permanent makeup treatment, but we're actually going to use it in conjunction with the Vytal treatment today. As you can see, the skin is slightly pink, so we can use the Cool Spot to cool down the skin and just minimize the redness for the client for when they're going home. Now, once the Cool Spot is activated and it's nice and cold, you can apply it to the skin, but not for very long. It feels quite cold, particularly straight after the Vytal treatment, so it's quite sensitive to the coldness, but it's actually quite soothing because your skin feels quite warm and tight after the Vytal treatment, so this just makes it feel a lot cooler and a lot more comfortable. So if you just go briefly around the face, and if you touch the face afterwards, you can feel it's nice and cooled down. And then you can start moving to the other side of the face.